Good morning, everyone. Welcome to the first quarter of 2023 and our quarterly meeting of the Palmetto Vision Alliance. I hope everyone is doing well this morning. We have a few folks still joining the call, but we are going to go ahead and get started. We will run through the introduction of our guest speaker and our program. And then we'll have some exciting updates for you on the Palmetto Vision Alliance website and our normal time for collaborating and sharing resources and opportunities with each other. So with that, I'm going to go ahead and get today's program formally started. And we're excited to have Libby Murphy with us, who is the Director of Program Development at VisionServe Alliance. Libby recently joined VisionServe Alliance after retiring from the Louisiana Association for the Blind. She had the honor of serving that association for 10 years, first as Public Policy Director, then Vice President of Strategic Development, and from 2017 to 2021 as their President and Chief Executive Officer. While there, she worked with Louisiana Association for the Blind's Vision Rehabilitation Center staff, contractors, clients, and other stakeholders to transform its programs into a forward-thinking, dynamic initiative that is sought out by individuals throughout Louisiana who are blind or have low vision. In addition, she led successful public policy initiatives resulting in legislation such as additional state funding for vocational rehabilitation services, which I know is something that a lot of our partners on the call are going to enjoy hearing about, and changes in state law that repealed exclusion of Ability One program employees from eligibility to apply for unemployment compensation. Libby holds a bachelor's degree from Louisiana State University and a master's in management from New England College. She is a resident of DeWitt, New York. She enjoys spending time with her family, exploring the numerous nature trails and waterfalls throughout the beautiful central New York area. Libby, thank you so much for taking the time to join us today and to give some of our members of the Palmetto Vision Alliance an overview of the first phase of the Big Data project and what that is showing us about information right here in South Carolina on the prevalence of vision loss among our older population. So without any further ado, I will turn it over to you.
Well, thank you so much, Daniel. I appreciate so much having the invitation, the opportunity to visit with y'all and share this information, not only about people who are older and who have vision loss in South Carolina, but also giving you a look at other states as well. And so we'll look at that. And without further ado, because I know we're on a schedule, I'll go ahead and share my screen, and I'm going to apologize up front. I was explaining to Daniel that there is an issue with my computer in that I think it's probably operator error actually, but my computer doesn't seem to like going into presentation mode. So if y'all are okay, we're just going to keep it in this mode, and I'll move on through the slides that way. So it is, and again, it is a pleasure to be here with y'all. Appreciate y'all's participation in the Big Data project, because it's the states and people like you who have helped make this project happen and bring light to information that we haven't had access to before, and that will help you in your public policy and services and in your strategic plans. It just has so many applications. So we'll just jump right into it. And the Big Data project actually got started in the fall of 2021. And we formed an alliance with the Ohio State University College of Optometry. Dr. Dean Van Nasdale there is an associate professor of optometry. And in addition to being a doctor of optometry, he has a PhD in public health. And his research area is vision loss as a public health issue. And it's just a perfect alliance for us to partner with the Ohio State University to conduct this particular research. Also, Dr. John Cruz, who is cited here on this first page, is a retired now, senior scientist from the Centers for Disease Control. And he also has worked on this project. And he actually is the one who, after all the numbers were crunched by the computer, he did the analysis, interpretation, and provided the narrative for each of the reports. So, and he has done many presentations about big data. And I'm always in deep debt to him for his generosity in allowing us to have access to to his work and to use it without limits. So basically, oh, and by the way, y'all interrupt me if you have a question along the way, because I really prefer a more conversational style. And so if you have a question or a comment, I'd love to hear it, and we can just make this a conversation as we move through. Y'all good with that? Thank you. So the Big Data Project is the first phase of what we hope to have 3 phases of. And this first phase was to look at people aged 65 and older to get a better grip on not only the numbers of individuals who are older and who have vision loss, but where are they? So, because we can look at the census all day long, and we can look at other data, but it typically comes out as statewide data. And I don't know about y'all, but in Louisiana, it really would be helpful to us to know where are the people who need this assistance.
Exactly.
So for this phase of the project, the goal was to provide each state with a report that estimates the prevalence of blindness and low vision, not only at the state, but especially at the county level. And we're going to talk about how that is being done. So, and also, you know, people who have vision loss don't have vision loss in a vacuum. So often there are complicating factors. What are the co-disabilities? What are the comorbidities? What about health-related quality of life and social determinants of health? You know, so this takes a broader look at people with vision loss and the complicating factors they may be living with in addition to vision loss. So Dr. Cruz loves using lots of quotes, and this is one of his favorites that I happen to believe in. I have a public policy background, and what I know in my years of working with policy, dating back to my days at LSU, not only as a student but as an employee, is that if you have the numbers, you know, then that helps back up what the anecdotal evidence that you're trying to get across. So Tim O'Reilly a long time ago said, "Who has the data has the power," and this is giving you the data. And the purpose of it, obviously, is to look at, you know, at advocacy. And it's my understanding that y'all may be looking at approaching your state legislature to attempt to have some funding passed that would be, I don't know what y'all call it in South Carolina and Louisiana, it's called a statutory dedication. And that's how, that's something that we got passed a number of years ago. And the 4 agencies in Louisiana annually get a statutory dedication. They have to change the law to change anything related to this money. And it's a statutory dedication of $2 million a year, divided evenly among the 4 agencies that provide services to people with vision loss. And we all know that what we do is done with love and by stretching a dollar as far as we possibly can. And that helps offset some of those uncompensated costs involved with providing services. So this kind of data helps support your advocacy efforts. And it also helps with your fundraising. If y'all write grants, you know, used to, you could write a grant and tell a great story and you get money. And these days you tell a great story and back it up with data, right? So this is very helpful to in that effort. In fact, in Texas, the San Antonio Lighthouse for the Blind has submitted, they haven't gotten an answer back yet, but they have submitted a grant proposal to the Administration for Community Living for a falls prevention grant related to preventing falls among older individuals who are blind. And this report really helped shore up the argument they were making for being awarded this grant. We'll know later this summer if if they get it and get that particular grant. So, and then of course, how do you know where the people are who need your help? And on a county by county basis. And that's what this also helps with. Any questions, comments so far? Okay. So these are our goals, is the state specific data and about people and their other perhaps complicating circumstances or factors, and the county level estimates of the prevalence of blindness and low vision among people who are age 65 and older. And so far, this is getting the job done. So the case definition and going into this translational research project is, are you blind or do you have serious difficulty seeing even when wearing glasses? That one statement is what helped put together the databases needed to be able to do the translational research that resulted in these individual state reports. So BRFSS, some people call it BRFS, is the behavioral risk factor surveillance system. And that is, it's the world's largest, that we know of, world's largest telephone survey. It is a program of the CDC, and it is conducted every year. And among the questions they ask the individuals they're calling is this exact statement. Then the American Community Survey, which of course is a program of the US Census Bureau, also asks this exact question. That provides the intersectionality of these two databases to be able to examine the data in both and pull out the information that we're providing, that's provided in the report, and we'll go over some of it today. And of course, every survey has limitations. When that question is asked, it is not scaled at all. It is a yes or no. It would be nice if there were a scale response, but it's just good that we're able to get this information at all at this particular point. And of course, there are no survey questions in either of these about whether or not the individual knows about or has access to vision rehabilitation services. So, and that's something that we'd love to get changed. So we'll start going into the data now, and the national prevalence of vision loss among people age 65 and older is 7.3%. In South Carolina, statewide, the prevalence is 7.7%. This is not, quite frankly, it's not surprising. And it's for a number of reasons, and we'll get into some of that a little bit. But y'all are just, South Carolina is just above the national average. So we'll start comparing some states here and some basic characteristics. And I'm not going to go over every single one of these numbers, I promise you. I am going to send the slide deck to Daniel, and if I could impose upon you, Daniel, to distribute to those who are interested in having it.
I'd be glad to.
So,
thank you, Libby.
I'm sorry?
I'd be glad to. Thank you.
Great. Thank you. So I pulled out South Carolina, Georgia, and North Carolina, since y'all are, basically neighbors. And then, of course, on the far right is the column that has the national prevalence there. So you can kind of see how that stacks up. So South Carolina is, in terms of the statewide prevalence, is below Georgia and North Carolina. And then in almost every category. And then one thing that I will point out that we've seen over and over again is when we're looking at minorities typically, not always, but typically have a higher prevalence of vision loss. And when we start looking at the counties, the county map of South Carolina, I want to ask y'all some questions about that. And but typically, though, this is what we see, that minorities, for whatever reason, whether it's lack of access, lack of psychosocial supports to help the person follow through with health care and eye health care and whatever, there are a number of reasons. And so South Carolina is a little bit higher, well, in the middle there. North Carolina is higher than y'all. Y'all are higher than Georgia, but it's still a good chunk of individuals. Where you see where there are dashes in this chart and in other charts, that indicates that the sample size of the individuals of that particular demographic, that just means that the sample size was not large enough to provide us with a confidence interval that's reliable. So just sample size is too small there. Okay, so let's look at some other states and where South Carolina lies among other states. So we have here again the US prevalence, and then South Carolina along with 10 other states. And Louisiana, my home state, I don't live there anymore after retiring, but it'll always be my home state, is so far in all the reports we've done, sadly, Louisiana has the highest prevalence of vision loss among elderly citizens. And when we start looking at the parishes in Louisiana, some of those numbers are very disturbing. Then, but y'all are at 7.7, and so pretty much in the middle of the pack. Illinois, always include that because they have among the lowest in the nation the prevalence of vision loss among individuals age 65 and older. So
Libby, I have a question while we're on this slide here. Based on your knowledge, VisionServe Alliance is a national, frankly, an international coalition. So you all have a much broader perspective on some of these other states. Is there a particular program or service that's offered in Illinois that is contributing to that lower percentage, or is it just how the demographics happen to fall? Do we know what's causing it?
Well, I think it may be the demographics of the state, although there is in Illinois, there are some significant numbers of individuals who are minorities and individuals of any race or ethnicity who have, difficult circumstances. And that is a deeper dive that we have not taken. And that's one of those next steps. So far, this one project has generated interest in at least 10 more research projects that takes a deeper dive into questions just like that you've asked. It's a great question. Our Janet Slick at Chicago Lighthouse and some of the organizations that reside in Illinois who provide services, that is typically what we rely on those organizations for, is to provide us information, because South Carolina better than anybody at VisionServe Alliance, and the people in each of these states know their state and those details far better. So the numbers either provide concerning thoughts, or they may provide information that's like, okay, our numbers are not as bad as we thought, but let's look at this pocket right here of people. And so we know we need to be putting our resources over here where this pocket is. That's a long, long way of saying, I don't know, but it does provide information for the users of this information.
Well, if you find a secret sauce in either Illinois or any of the other states that you're working in, please report back and share it with us.
Absolutely, and that is certainly one of the research projects that, I mean, it'll be software research, but we do want to know what sets us apart of all those states that do have the lower numbers. Is it because do you have fewer? Are you a younger state and you have fewer people who are elderly, and among those who are elderly, are they simply healthier? Do they have more access? Do they have more resources to be able to take advantage? So those are all things that we would want to find out. And along with that, what does that low number? How are the vision rehab organizations contributing to that lower number? Because people have vision loss. I mean, if there's a lower number, typically it's because, of better health care and that kind of thing, and they've never had to have vision rehabilitation, right? So yes, the answer is yes. We will definitely, as we get more information about each state and we're able to add on the deeper dives to this research work, that is something we want to share with everyone.
Thank you.
Thank you. Okay, so here's your state. And this is, state map with each county color-coded in a blue gradient with the lightest blue, meaning the lowest prevalence. It's divided into quintiles, so 5 different quintiles, and the lowest being that very light blue, and with the prevalence there being 3.8% to 5.6%. That's the range for that lowest quintile, ranging all the way up to 22.3%, and that is in Allendale County, right where that red dot is. And I put a red dot on that county to show that as the county that has the highest prevalence. And then the county with the lowest prevalence is, I always pronounce it Beaufort. Is that correct? How do y'all pronounce it?
We say Beaufort here in South Carolina, but I know that's how our North Carolina neighbors say it.
Yeah, well, being in Louisiana, being from Louisiana, BEAU is Beau.
It's probably the more accurate French rendering of the word, but we say Beaufort here.
Okay. So Beaufort County is the county that has 3.8%, the lowest. And then many states, when we look at this map for each state, many states you see groupings of counties that have that are at the lowest end, lowest prevalence, and groupings of counties that are at the highest levels. And that is true here in South Carolina. You have with Barnwell, Bamberg, Orangeburg County, and Clarendon, Sumter, own up. And then you take a little bit of a dip in Darlington and Florence, but then it picks back up there at Marlborough and Dillon counties. And so what are the demographics there in these counties? Are these perhaps more rural counties, traditionally more rural counties, perhaps were and have been for hundreds of years?
So I really want to invite our members to join the conversation here. Libby, we have on the call with us this morning representatives from the South Carolina Commission for the Blind, the South
Excellent.
Carolina Department on Aging, and a couple other statewide nonprofits that are working in these counties. I don't want to monopolize the conversation, but there is a very particular trend in that area in the state and a long history of it. And I would invite any of our members that are working or serving in those areas to offer your particular insights.
Libby, this is Rhonda Thompson. I work as a program lead here at the South Carolina Commission for the Blind. And I actually had the pleasure of meeting you when you shared the big data findings with our commissioner, Darlene Graham.
Yeah, and I remember that was back in the fall, wasn't it?
Yeah, back in the fall. And I remember it was great information. It just sort of supported, Daniel, we shared with Libby then that it supported what we knew and what we anticipated among our senior population. But when I saw that you were sharing again this morning, I eagerly awaited to review this again and further validate what we know, the individuals we work with. What is curious though, I'm looking, and this just tells me that we've got to do more over in Allendale. Our numbers, while that seems to be on your map a high prevalence of blindness area, Allendale, we have very few referrals there. It's very underserved. And then the opposite, for Beaufort, we have a few higher numbers. But I will tell you, for me, looking at our current older blind map with caseload numbers, largest being Charleston, excuse me, Charleston, of course, Richland County, Greenville, our entire state. I'm glancing over right now. Greenville has our largest numbers. Greenville.
Interesting. And they are in the second quintile, which means they're the second lowest in the state. Yeah, and but here's the thing though, is that is Greenville perhaps a more prosperous area and of the state? And the reason I ask that is so often we're seeing, not always, but often we're seeing that counties that are more prosperous, the demographics are people who have education and resources and access to taking advantage of resources like what y'all offer, where in the poor counties, where people, even if they've had access to an eye physician, they just in that optometrist or ophthalmologist or even their general care physician has said, well, you would benefit from vision rehabilitation services. Well, how are they going to get there? And because I don't know the distribution of services in y'all's state. I do know in Louisiana, the most rural parishes there, people have to get somebody to drive them. Well, who's going to drive them whenever those who have a job are going to those jobs and the hours of the services don't necessarily line up, so they don't have anybody to take them there. And then what about the follow-up supports if the individual could receive services under the OIB program, then that's more than one visit. And if an organization is not set up to provide either to go into the home and help provide services and help them adapt their home, that kind of thing. So there's so many factors that go into it. And, I can tell you that, I'm thinking right now in particular, Tensall Parish in Louisiana, that there's so few resources there. It's unlikely that an older individual would ever even hear of any possibility of vision rehabilitation services that might help them enrich their lives. I'm fixing to get on a soapbox, y'all, so feel free to stop me.
I know that it's something that's passionate for all of us, Libby. And to answer your question about Greenville County specifically, Greenville County is a very diverse county. The city of Greenville is one of the largest and probably in the top three most prosperous economic cities and hubs in the state of South Carolina. But there are a lot of rural parts of Greenville County, particularly in the north and south of the county, outside of the city of Greenville and outside of the sprawl of the city of Greenville, that frankly would be indistinguishable from parts of Allendale or Marlborough counties, except for the mountains that they have in Greenville.
Yeah. So, yeah, interesting. So, I mean, and this is where we rely on, y'all as being, y'all are the subject matter experts about your individual counties and the resources there, the demographics, et cetera. So, and just to let you know, it's across the South, we have seen some trending that spills over, across state lines. And that's not necessarily true. When you get here in Georgia, I first thought, well, these two counties that are across the state line from Barnwell and Allendale, let me look at those. And they are not. In the state of Georgia, they're more like the third quintile. So pretty far removed. But up here, across from Oconee, is that how you pronounce it?
Yep.
Across from Oconee, there's this teeny little county there that is in the fifth quintile there. But when we go on up and you go up this band of counties, and Rhonda, I do remember us talking about this band of counties, and then we, go on up and look up here in North Carolina, these counties that are across the state line from Marlborough and Dillon, and there's a whole band of them that just continues to go up into the north, heading in the northeast direction across North Carolina. And, those are vestiges of, years gone by. And, and the same thing is present in Louisiana as well. So, but one reason I'm interested in looking at these particular aspects, like how it crosses over, to me that provides opportunity for working with people across state borders to perhaps get regional funding to help shore up your services and that kind of thing. So anyway, any questions or other comments about this? And y'all, whenever I send the slides over, I have a cheat sheet here, so I'm not going to pretend that I knew all of these counties' names. I have a little cheat sheet that shows which quintile and the prevalence of that county for each county. And if y'all would like to have that, and it's color coded, if y'all would like to have that so you can have a quick glance and know just at a glance what that county is, I'm happy for y'all to have that. Okay.
I'm with Operation Site. We provide cataract and retina surgeries to South Carolina residents, and we've been looking at our data and our referral data a lot, especially along that 95 corridor that we've been looking at. And we also serve the most people in the Charleston, Beaufort, Greenville area. And those referrals come from clinics and physicians is what we've been seeing just with our data. And the patients that we do see are lower in that area, and their referrals are often family members and online searches. So they aren't having access to those free clinics. They don't have access to the doctor's offices. From our data is what we see. So we're working with our doctors in Walterboro to see if they can help us connect to some of the resources that might be available in those areas. But we've definitely noticed a huge change in or difference in our referrals from those areas to the greater population that we serve in the Charleston, Tri-County, Beaufort, even Georgetown area. They just have access to a lot more resources.
That's a really great observation, Taryn, and that's very affirmative of some of our experiences as well, working in these areas. I looking at this map, I don't think we can make a clean cut rural urban divide in these counties. I'm looking at some of these, and Union County, just beside Spartanburg, and McCormick County, right there on the Georgia, South Carolina lines, are two incredibly rural counties that should, if that was the delineation, should have the same prevalence as those I-95 corridor counties, but they don't. And to not put too fine a point on it, although maybe a fine point needs to be put on it, that I-95 corridor has historically been overlooked and neglected from the standpoint of state level investments. The state has very intentionally kind of not brought economic investment and developments to those counties along that corridor. And so there are some generational challenges there, and there are some, at this point, systemic issues with providing services in those counties and getting those counties up. I mean, the fact that Florence and Darlington dipped down a little bit, Florence is one of those bigger cities, and it's probably one of the biggest cities in the PD region in that part of the state. So again, there's been a generations long neglect of those communities that is long overdue to be rectified, frankly.
And this information, just helps support that that particular argument. And I've seen these kind of trends a lot whenever I'm looking at southern states, which obviously is my particular bias, and to look at the southern states. And you see similar things whenever, all of the Southeast United States is called the diabetes belt. And South Carolina is no exception to that. And but you see that same kind of trend in whenever you're looking at that aspect. And and we're about to get into some of those additional factors that may contribute to that, in addition to the socioeconomic factors that exist.
And Libby, I do want to acknowledge we're a little over our allotted time for the program, but no, that's okay. We've had some good conversations on this. This is highly relevant data for our communities that we're serving here. So we'll condense some things later on in our meeting, but we don't want to take away from your presentation. So please press on.
I'll stop editorializing and keep moving. Okay, so knowing the prevalence is not enough. You need to know the additional complicating factors that that put the individual at a disadvantage in more ways than one. So we'll look at some of those right quick. And so when you look at the disability status among this age group, and in every case, the group of people who are those who do have vision loss, age 65 and above, in the categories of what used to be called activities of daily living. There's some other phrase for it now. But when you're asking the person about their difficulty in concentrating or remembering, or walking and just climbing stairs, dressing or bathing, running errands, it's significantly higher for people with vision loss in every category, and every one of these 4 categories. And it happens too often that individuals who are older, who have vision loss, maybe thought, oh, they're developing dementia. They can't walk up the stairs anymore. Or, they can't climb stairs anymore. They are, having trouble walking and bumping into things. Well, that could be low vision, and something that some O&M training could help, right? And so there's all of these things that go into it. And so you can see the significant difference, all of which, for people with vision loss, having the opportunity to have vision rehabilitation services can help them with every one of these areas. And in the concentrating and remembering, I mean, if you couldn't see, you have to retain so much more, right? And so if, getting some training and some assistive technologies, or perhaps having, an electronic magnifier, those kinds of things. But it's always going to be more difficult if the individual has no knowledge of and no access to vision rehabilitation services, all of which, every one of these skills could be helped with that, right? Okay, and here's the part where, and I know this is a busy slide, and just in looking at those same 11 states that we looked at earlier, this is the one that begins to get me up on that soapbox even further. When you start looking at those individuals who say they cannot get care because of cost, and this is among people with and without vision impairment, age 65 and older. Look at the difference here in South Carolina, among people without vision loss, who are 65 and older, who say they cannot get care. That prevalence is 5% statewide, but it's 4 times that for people with vision loss. 4 times. So, yeah. As a matter of fact, you're North Carolina and South Carolina are pretty much on a par with that. So these are some very concerning figures all the way across the board. But you can see some states where the disparity is not so great, but it's tremendous, typically in the southern states.
Yeah, Libby, I think this really just underscores the importance of this project at the state level for us, because most of the national data, when you look at the national aggregate data on the distribution of costs for the blind and visually impaired, once you get to that 65 and over population, the majority of that cost, the data shows, goes to the government, not to the individual. But as you can clearly see and have pointed out so clearly here, that's not the case in our state. There's a disparity there that we need to address. So having this information is particularly important when the local data doesn't correspond to national level data across the board. So very helpful insight here.
Exactly. And, we can also get into the thing about people who are older who should be able to age in place, but because they have vision loss, it's like, oh, you're not safe at home anymore. We're going to have to send you to, assisted living facility or nursing home and that kind of thing. Well, if they already don't have resources, then, or what few resources they have, they burn through that quickly, and then have to go on Medicaid. And, without ever even looking at having an assessment done that if this person were to receive vision rehabilitation services, including, learning some adaptations of their home and some adaptive skills so that that individual can age in place. These figures show very clearly the absolute need for vision rehabilitation, not only because of the quality of life of the individual, and everybody is deserving of that level of care and respect for their independence and hopefully ability to age in place. And so there's that aspect of it. But let's face it, folks, it's also the aspect of how much this is unnecessarily costing in terms of making assumptions that this person can't see, so they need to go in a nursing home. And, you know, our tax dollars are stretched enough where those funds could be used for helping individuals age in place. Again, comparing states for the individuals whose annual income is less than $20,000 among those individuals with and without vision impairment in each state. And this is annual income in this case is income from all sources. So, and this is less than 20,000. And who can live on $20,000 a year, right? In this day and age. So you see there that it's the individuals with vision impairments, you know, the prevalence there is, you know, 40%, which is about double those without vision impairment who make less than 20,000 a year. So yet more disparities among those with vision loss and without vision loss. Any questions about this? Okay. And then we can further break that down that in South Carolina, here is what we're looking at in terms of people who are blind who make less than $10,000 a year, less than $10,000 a year, 13.6%. And then you go to the 10 to 15. So it just gives you a further breakdown. So, you know, somebody might be told, well, you know, you would be able to see better if you used a 100-watt light bulb. If you make less than $10,000 a year, are you going to be budgeting for a 100-watt light bulb? So then we start looking at the education characteristics, and you see the disparities there as well. And, you know, of those individuals who did not graduate from high school and who perhaps did, and who, you know, college, et cetera, et cetera. So you can see of college graduates, then there's a big disparity there. So we're coming on the home stretch. And again, the contributions this research project makes is for us to be able to look at our individual states and to have an idea of the complicating factors of the residents of our state who are older and who have vision loss, but what are the some of the complicating factors that go with that. And this is the only study that has been known, and a great deal of research was done to find if there has been another study even similar to this. But this is the only one that so far that has provides the county level estimates, which, you know, we believe is will be very helpful in pursuing vision rehabilitation or greater funding, or whatever purposes you're using this for. And and I'm just going to read this one sentence because I don't believe in reading to people, but I do want to underscore that the Big Data Project does demonstrate that many older people with blindness and low vision are often disadvantaged in multiple ways. And that has been borne out in every single one of these reports we've completed to date. So it serves as a foundation for you to be able to, as you're doing your strategic planning and as you're developing your public policy agenda at the local, state, and federal levels. And it also helps, just like you have others, you know, multiple stakeholders. Everybody in this call is a stakeholder representing you know, a different area. So this helps to engage and to provide that evidence. And again, as you know, I mentioned earlier, it's so important to support your anecdotal evidence with this data. So once again, another quote, love this one: without data, you're just another person with an opinion. So this has been very the project has been very supportive for others. Do want to acknowledge our principal investigators who I've mentioned earlier, Dr. John Cruz, retired from the CDC, and Dr. Dean Van Nasdale at the Ohio State University College of Optometry. And if you have questions, as you think about this, as you look it over, if you have questions, want to discuss anything, I welcome your email, your call, and most of all, I appreciate y'all's ongoing support of this project and happy to help you in any way we possibly can. Thank you.
Well, Libby, thank you so much for sharing this relevant and engaging information with us today. I would be remiss if I didn't take the minute to thank a couple of key individuals and organizations that made this project and this report possible for South Carolina. Courtney Plotner is the CEO of the Association for the Blind and Visually Impaired South Carolina and is also a VisionServe Alliance board member. She was the individual that originally brought this project to us and said, we need to get this report for South Carolina. And her leadership was an important driver of this. And of course, projects and reports like this cost money and they require investment and resources. And we presented the opportunity for all Palmetto Vision Alliance members to participate and contribute to that project. And for the first phase of this report, we had contributions from the Association for the Blind and Visually Impaired South Carolina, Lions Vision Services, the South Carolina Commission for the Blind, and the Vision Institute. And those funders really helped ultimately bring this report from a concept to a tangible product to fruition for us. So thank you to the representatives from all of those organizations that made this a priority. I do want to let you know that this report is available online. Part of one of the priorities of the funders of this project was to make this information free and accessible to all of our members and to the public, to our policymakers. So we have a local publication here on the Lions Vision Services website that has a link to the Big Data Project Phase 1. That's at lionsvisionservices.org/publications. This is the South Carolina report. And again, it's Phase 1. There are a lot of other age demographics that we have not touched yet. So stay tuned for Phase 2 and probably a Phase 3 as well for the timelines, as well as investment opportunities if you would like to join us in future projects. And all of these reports are available on the VisionServe Alliance website as well, visionservealliance.org/reports. There's a great overview on the project itself. There are the state reports for all of the reports that have been done so far. So if you want to dig into some of those counties right on the borders of South Carolina, the Georgia report and the North Carolina reports are both on here. And then South Carolina is as well. So again, VisionServe Alliance has all of them. And then at the Lions Vision Services website, we have the South Carolina one as well. I want to take a minute again after thanking and acknowledging those to leave some time for questions for Libby. If anybody has a question and would like to come off of mute or share it in the chat, we would love to take advantage of this time that we have with Libby and address any questions that you all might have.
Well, I would very much like to, again, express my appreciation for all of you for your support of this research project, for making it possible. And if I can just real quickly share with you my experience when I was at LAB. Early on, when I started at LAB, I asked for data and I was like, well, we don't have any data. And I went to the Office of Public Health and ask about the BRFSS data. And well, Louisiana doesn't subscribe to that portion of it that includes the vision part and that kind of thing. And so I contacted the LSU Public Policy Research Lab and said, can we do a study? And because I was on the State Rehabilitation Council for 6 years and chaired it for 2. And during that time, we had commissioned the Public Policy Research Lab to do a study of the ROI for the state dollars put up for rehabilitation services in general to get that $3.69 drawdown for every dollar the state put in. So they did that study. And, oh man, I'm going to talk to them about doing one for let's find out about people who are blind in the state of Louisiana. $155,000, y'all. So 10,000 bargain.
Absolutely.
But it's still a lot of money, and I really appreciate y'all all working together to make this happen. Thank you very much. If you think of anything, if you're like me, later on I go, oh, I wish I'd asked this. Email me, call me. I'm happy to hear from you.
Thank you, Libby. We'll be sure to share the recording from today, as well as the slides and the cheat sheet that you've got for us with all of our members here. And again, thank you so much for your help and for your leadership on this initiative.
Thank you, Daniel. Appreciate your leadership as well. And I hope to talk to y'all again soon. Thank you. Bye-bye.
Thanks. Bye-bye. All right, we do have one or two other quick items, and I know we're technically at 10 o'clock, and one of the pieces of feedback we heard from you all last year was condensing that 90-minute meeting closer to 60 minutes. So I'll be very quick with these updates. I wanted to share with you the results of our rebranding efforts. So you all probably remember that we have a grant from the Blue Cross Blue Shield of South Carolina Foundation to develop and build out the website with the inventory of all of our services that are offered for the blind and visually impaired across the state of South Carolina. They graciously offered the folks that we've selected at 37 Gears to do that website, to do some rebranding for us. And we presented 3 options last year and put the question to you all as to which one would ultimately be the new brand for the Palmetto Vision Alliance. And from those 3 options, the group selected option 2, which is what we have committed to and are moving forward with. So this loosely evokes an eye or hands clasping or palmetto leaves. It's a very versatile and useful brand and logo, and it's also one that lends itself very easily to high contrast as well, which will be an important accessibility component to the website. So wanted to share that. Thank you all for taking the time to respond to that survey last year. We also are in the process of building out that website that I mentioned. We have survey results from about 16 of our members. So if you are not sure if your organization completed that survey with an inventory of your services and you want to make sure that your organization is included, please reach out to me. We want to make sure that everyone is a part of this and is featured on that new website. I have 2 requests that I want to put out to the group. One is if you all could send a profile of your organization. We hope that each member of the Palmetto Vision Alliance will have a designated landing page or web page on this new site that provides an overview of who you are, what you do, how you provide services to the blind and visually impaired across the state, what your eligibility criteria are, and so forth. So if you could send an overview, either text or images, whatever you would like on your page of the site, please email that to me at daniel@sitefirst.org, and we'll make sure to include that as well as your organization's logo if you want the most recent version of that included on the new site as well. We're also trying to identify brand or stock images for the site, and we want to be intentional about being inclusive and reflective of our entire community with those images. That's something that if you've ever worked with stock images related to the blind and visually impaired before, that's a challenge. So if you all have any images from your organization, whether it's providing services or client testimonials or anything that you would be willing to share with us, we would love your input on that and contribution to that. And again, you can send all that to daniel@sitefirst.org, or if you've got a lot that you want to send over, reach out to me and we can set up either a Dropbox or a Google Drive link and get that transfer initiated. We would greatly appreciate your help, and particularly with those brand images, we kind of need your help to build those out and make sure that the website is engaging and appealing both to the blind and visually impaired that will be using it to find services and to the general public that will be using it to learn more about vision and eye health in South Carolina and about what we all are doing on a regular basis. So those are the couple of updates on the Palmetto Vision Alliance website. The plan, the tentative goal, is to have the site ready to go by early summer of this year. So time is kind of the essence. We're into spring already, and by the time we blink, we'll be in summer. So if I could get your help with that, that would be greatly appreciated. With that, I want to open it up to discussion for anyone who wants to stay on the call. If you have any needs, any events, any updates, any opportunities, just anything in general that you would like to share with the group, we'll hang out for a few minutes here to continue those conversations. And we invite all of you to keep us posted on events and happenings at your organizations. Feel free to just jump off of mute and contribute to that. Or if you've got links or things that you want to put in the chat, please feel free to use that as well. All right. Well, thank you all again for participating in today's call. I hope that you found Libby's presentation helpful, and go ahead and mark your calendars now for our next Palmetto Vision Alliance meeting, which will be Tuesday, May the 16th at 9 a.m. And that will also be on Zoom. So thank you all for your help. Look forward to keeping in touch between now and then, and have a great rest of your day. Thank you, everyone.